Hi, thank you for joining us today. My name is Amelia Ott, and I work for Family Resource Navigators. I'm the program manager for our supported decision-making program. And today we are going to be talking about using supported decision-making in healthcare advocacy. We are grantee of the Supported Decision-Making Technical Assistance Program through the State Council of Developmental Disabilities program. And in partnership with Support for Families, we created this curriculum. So we'll go ahead and get started. So our learning goals today are going to be learning about patient rights in the healthcare system. We're going to talk about how to file grievances and understanding some state level healthcare complaint processes. So as a patient, what are your rights? So some important rights in California and the healthcare system. You have a right to an appointment with your primary care doctor within 10 business days, with a specialist within 15 business days, and with urgent care between 48 to 96 hours. You should be able to reach a qualified health professional by phone 24 hours a day, 7 days a week. If you need a call returned, you can expect a call within 30 minutes of leaving a message. Many times you will find that that is not the case, but that is the expectation. And if you are finding that you are not receiving that level of care, you are able to file a complaint regarding that. So if English is not your first language, your health plan has to provide you with assistance in your language at no extra cost, along with important materials. So that could be through a translation service, or that could be with written material. You have the right to select your own doctor. You also have the right to select a second opinion regarding a health issue. So if for any reason you are talking with a doctor about surgery, and you're uncertain and you want a second opinion, you can find another doctor to talk with and kind of hear what their opinions are. Many times there are different opinions and differing options that maybe that first doctor didn't consider. You can ask that your diagnosis and treatment options be explained to you so that you understand it. I mean, you can ask for this information to be written down. So just because you are talking to a doctor in person in the office, you can also ask for them to send you that information in written format, whether that's via email or if you need it printed out to you in person. Those things are within your rights. And then you can also request that your diagnosis and treatment options be explained to you so that you understand them. And then, of course, that it can be written down. Sorry, that is a repeat there. And then what can I do if I have a complaint? So a complaint is also known as a grievance. So you'll kind of hear those interchangeably in the healthcare system. You have the right to file a grievance with your health plan. You may want to talk to your doctor first to see if they can help. So many times talking to your doctor before you file a complaint or a grievance can help resolve the issue. Sometimes seeking a second opinion also can negate or have no need to file that complaint or grievance, right? The complaint and grievance process can many times take a lot longer, but many times once you've gone through those processes, you still need or want to file a grievance. So that is still within your right. So how do you file a grievance using supported decision making? So you can begin the process by calling your health plan, member service phone number, but you can also submit that via letter and via email. Many times also now you can submit it through your health plans like application. Many times they have it in their app on your mobile phone, or they have it on their URL login, like MyChart, or if it's Kaiser through their online login. If you are using supported decision making and you have a supporter that you have selected, they may need to be present during the process, and you may need to have them as an authorized representative, or you may need to have documentation on file. Because it's a healthcare system, they may need to have specific documentation outside of just a supported decision making agreement, to ensure that that supporter is able to continue that communication. It's sometimes very important, because the information is going to be HIPAA compliant. They are going to have like a higher level of compliance that they need to meet. So when you are filing the grievance, you want to state clearly the problem that you are filing the complaint about. And then you are going to explain the problem in as much detail as possible. If your issue is urgent, you want to explain that and why it is urgent that they expedite it. Sometimes there is no urgent need, right? And it can just take time. We don't necessarily want it to take time, but maybe your complaint is about a doctor and additional training needs to be provided to that doctor because of the way that they were handling something with you. But other times it's a complaint in regards to, a surgery, and the medical care that you're receiving in regards to a serious medical condition. And there needs to be an investigation and a complaint and a resolution handled in an expedited way. You can also ask your doctor or a doctor outside of your health plan to assist you by writing a letter explaining why you need the service. And so many times, the doctor that you are working with is supporting you in filing the grievance, right? It's not just always you filing the grievance yourself. So, asking your doctor, talking with them first, it's really important. And then you must file your complaint within 6 months of the incident or action that caused the problem. And so after your complaint, your health plan must provide a decision within 30 days or within 3 days if your health issue is urgent. So, what do you do if you need help with a grievance? So, many people can file an appeal with one of the state help centers listed below. If they can't help with your appeal, the state help centers will refer you to the right place. So, if you are part of a managed healthcare system, and that's most of the health plans, you can contact the Department of Managed Healthcare, and you'll see their information, and they'll be able to refer you out if for any reason there's something else. And then if not, you can go to the California Department of Insurance, and they can help with PPO plans and many other kinds of insurance plans. Okay, so you filed a grievance and didn't work. Is there anything else that you can do? Let's talk about that. So you can request an independent medical review. So if for any reason your health plan denies, changes, or delays your request for medical services, denies payment for emergency treatment, or refuses to cover experimental or investigational treatment for a serious medical condition, you can apply for an independent medical review, which is an IMR. So what does an IMR not consider, right? So what can it not do? So the health claims denied by the insurance company because the service of treatment is not covered under the insurance contract. So many times your insurance plan's benefit does not cover certain treatments. And so an IMR cannot review if the treatment is not covered under your insurance plan. And so many times that is the case. So in the past, this is just for an example, maybe the insurance plan does not cover orthodontic services, right? And maybe you want orthodontic services. Then IMR cannot review that because orthodontry is not covered. So what's the process? Um, it's a process in which expert independent medical professionals are selected to review specific medical decisions made by an insurance company. So we know insurance companies look at dollars, right? They want to weigh how much money certain treatments are going to cost. They may not be looking always at the best interest of the patient, and that weighs into their decisions. Now, an independent medical professional, when you take money out of that, they are going to actually look at the need of the patient to receive the treatment and the benefit to the patient. So, what are the reasons? So, insurance denial for a treatment, therapy, medical equipment, or medication on the basis that it is not necessary, it is not considered medically necessary. So, an example, a surgery or diagnostic test that your doctor orders, but the insurer says no because they don't believe it's needed. So, the prescription medication that's denied for non medical reasons or because insurer disputes necessity and claims another works as well. So you'll find this with like a generic medication, a prescription. However, there is a specific formulary that a doctor prescribes, and your insurance is saying, no, you can take the generic option. And possibly you have tried the generic version before, and it has not been as effective. And the doctor is now saying, I want you to try this specific formulary to see if this is effective. And your insurance keeps on denying that request for you to take it. This may be a place for you to have filed a grievance. The grievance may have come back, and then maybe filing an independent medical review. All right, so let's talk about medical necessity. Although there are many definitions of medical necessity, depending on the health plan, they do share some common features. Generally, these features are the care should be appropriate, it should address a problem or enhance the patient's health, functioning, or well-being. It should be provided according to standards of good medical practice or generally accepted medical practice. The care should not be experimental, educational, or investigational. And so that's one of the last one, kind of experimental, educational, or investigational. Many times there are, studies or there are experimental drug trials, and those are certain areas that are very difficult to navigate, where insurance companies don't want to cover them because there may not be enough medical necessity there. And so an independent medical review would not necessarily justify the fact of those. All right, so a denial of urgent or emergency services. If you need an urgent or emergency medical service and the insurer denies or delays paying for it or providing it, experimental or investigational therapies. When a treatment is considered experimental or investigational and is refused by the plan, you can ask for an IMR. The law has specific rules for when this kind of denial is allowed, right? And so that's, again, what we were talking about, is that there are very specific ways where they really look at it a little bit differently there. All right, so how are you using supported decision making through the independent medical review process? So if you want to authorize someone else to assist you during this process or during the complaint, you have to designate them again as the authorized representative. And so again, with the supported decision making agreement, it is recognized in California. However, many times these independent medical reviews, because it's through a health plan or because it's done through maybe a medical professional that is outside of California, even though they are supporting California, there may need to be an additional authorized representative form filled out specifically for the process. It's found on the third page of the application for the IMR, and you can also send a copy of a power of attorney with the application. So some important hints are before bringing an issue to IMR, you usually must complete an internal appeal process for your health plan unless it's urgent, right? So that internal complaint or the grievance process. So you need to make sure you have all the relevant documentation, such as the IMR form, denial letter from your insurer, and all relevant medical records, right? And so that can be letters from the doctor, your medical records, the denial letter, the IMR form, anything that's relevant, right? And many times that's gathering more documentation than is needed to ensure that there is more information to review rather than less. Like I mentioned, getting a strong letter of support from the primary care doctor as to why this particular treatment, drug, or equipment is needed, and then gather any additional information, any tests. You can get specialist opinions, and again, you can get published studies or reports. So if that means you doing research online, if there are reports or from the National Health Institute, that information can be submitted with your IMR. All right, so getting a favorable decision in IMR can be a big lift for advocacy. Filing an IMR takes time and the support of your medical team and your supporters. An IMR is definitely a circumstance where a strong circle of support makes a difference. The IMR process can be long. It takes steps. There's lots of conversations, and it goes back and forth, right? They may ask for additional documentation. They may have additional questions, right? And so there may be phone calls, there may be video calls. So having that group of supporters between the person with the disability and the supporters, and having a clear chain of who's responsible for making the appointments and who's responsible for gathering additional documents. All of those people having a clear understanding of who is responsible is very, very important. But it can also be an important tool to getting the healthcare services that you need. So again, thank you for taking the time for watching this video. This work was made possible through a grant with the State Council of Developmental Disabilities. If you want to learn more about supported decision making, you can find us at yourdecisionmatters.org, and you can learn more about Family Resource Navigators at familyresourcenavigators.org. Thank you so much again, and I hope that you enjoy the rest of your day. Bye-bye.